All right, welcome everyone to Breakout Session E3, Advancing Healthy, Sustainable, Plant-Forward Menus in Healthcare Food Service. We're really pleased to have partnered with Healthcare Without Harm for this session, highlighting plant-forward innovators and leaders in the healthcare food service sector. In fact, to kick things off, we have Lucia Sayre, Director of Regional Innovation and Community Resilience for the Healthy Food in Healthcare program at Healthcare Without Harm. Lucia has over 25 years of experience in food systems and food and community organizing. And give me just a second while I bring her up on stage with me here. Hi, Lucia.
Jackie. Well, thanks, Jackie, and many thanks to the Culinary Institute of America and Harvard's T.H. Chan School of Public Health for continued partnership with us at Healthcare Without Harm and the opportunity to participate on this panel today with such accomplished healthcare food service colleagues who you're going to meet in just a few minutes. For those of you who may not be familiar with Healthcare Without Harm, I just want to take a few minutes to provide some background about our mission, goals, and our food program work before Jackie introduces the panel. So Healthcare Without Harm as an organization was founded on the belief that as the only sector with healing as its mission, healthcare has an opportunity to use its influence to create ecologically sustainable, equitable, and healthy communities. Next slide. So Healthcare Without Harm, founded over 20 years ago, seeks to transform the healthcare sector worldwide so that it reduces its environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health justice. We conduct research, we build models of strategic interventions, and provide guidance and resources to spread and accelerate best practices in the field, and have programs focused on climate and health, safer chemicals, healthy food, and others. And then our membership organization, Practice Green Health, is the leading membership and networking organization for sustainable healthcare, delivering environmental solutions to hospitals and health systems across the US. Next slide. So the Healthy Food in Healthcare program was founded in 2005 and works to harness the expertise, purchasing power, and investments of the sector to advance the development of a healthy, sustainable food system. Hospitals are influential institutions in their communities with power to impact social determinants of health and promote greater sustainability, equity, and health in the ways that food is produced, processed, distributed, and consumed in our country. With regional innovation hubs and organizing staff on the ground in California, New England, the Northwest, and the Southwest, Healthy Food in Healthcare builds model strategies and creates resources that support health systems to become leaders in shaping a food system that supports prevention-based healthcare. We use these examples, these regional examples, to scale that practice across the country through national campaigns and our Practice Green Health membership. With a network of over 1,000 hospitals engaged in healthy food strategies across the country, we benchmark and report sector progress to build a national community of practice. So on this slide, you can see the Healthy Food in Healthcare Pledge, which is a commitment that hospitals make to improve the health of their food service. And you can also see an overview of some of the 2018-2019 data we collected regarding the trends in the sector. So for example, about 69% of the hospitals in our network have reduced the amount of meat they purchase and serve. 69% are choosing meat products raised without the routine use of medically important antibiotics. And 70% are purchasing sustainable foods, and 79% are purchasing local foods. These are just some examples of the kind of data that we are tracking within our hospital network. And a key organizing strategy in our work is really to start with hospitals wherever they are in this journey. and to support and celebrate their efforts along the way. So there isn't one right linear path for doing this work. Hospitals can begin with looking at reducing the amount of meat they serve, or supporting local produce farmers. Whatever seems manageable to them, we'll start with them there. Next slide. So at the foundation of our work is this concept called environmental nutrition. Environmental nutrition really defines what constitutes healthy food for us and for the Healthy Food and Healthcare program. So when considering whether food is healthy or not, we aren't just looking at and considering the nutritional, biochemical components of a food product. We take into consideration the social, political, economic, and environmental factors that go into the production of that food. So where and how was that food grown? Who grew the food? What labor standards exist on those farms or ranches? Were harmful pesticides used in the production or processing of that food? And it's this framing of environmental nutrition that drives our standards as to how we define healthy food in our program with hospitals. Next slide. And a lot of progress has been made throughout the past 15 years. So hospitals and health systems are improving food systems and food environments, both within their facilities and in their communities. Some key strategies within their facilities include using food service purchasing to support regional and sustainable food production, and in some cases, even growing food for the food service right on campus, on hospital gardens and farms. A second strategy is improving on-campus food environments to be healthy by default. This strategy really provides access to healthy food, but also serves to promote healthy eating for staff and patients and visitors to the facility. And a third strategy is addressing food service operations that have environmental impacts such as food waste reduction and energy efficiency in the kitchen. Healthcare Without Harm has developed and continues to update a set of criteria, standards for local and sustainable purchasing that hospitals can use when making purchasing decisions. And we are currently working with the Center for Good Food Purchasing and Real Food Generation to develop a single set of standards for hospitals, K through 12 schools, and universities to really align institutional food purchasing across the sectors and send a singular message to manufacturers and distributors. Next slide. Some key strategies that healthcare systems are adopting to help build healthier food systems outside their four walls in their communities include increasing access to healthy, affordable, and locally produced foods through initiatives such as supporting community gardens and farms, implementing fruit and veggie prescription programs, farmers markets and mobile markets, and CSA programs, community supported agriculture programs. Another strategy is increasing community knowledge of healthy eating and supporting local ag practices through teaching kitchens and other educational collaborations. More recently, facilities and systems are leveraging their community benefits programs and other investment opportunities to support these interventions and really expand the reach of their impacts within the community. And finally, clinicians and other health professionals are advocating for change at the public policy level, where their health expertise and perspective can be a critical motivator of policymakers. So on the slide is a photo of a group of clinicians advocating for change in Washington, D.C. during Antibiotics Awareness Week. Next slide. And as plant forward is trending and chefs are discovering creative recipes that satisfy customers and increase sales, hospitals in the Healthy Food and Healthcare Network are cooking creatively and collaborating across food service and clinical care departments to highlight the mouthwatering flavors, health, and environmental benefits and cost savings that plant-forward meals can provide. So some of our work in the Healthy Food and Healthcare program to promote plant-forward include providing guidance to hospitals and healthcare culinary professionals to reduce the amount of meat they serve and increase whole foods, plant-forward menu options. Another one of our initiatives is creating opportunities for healthcare food services to show their commitment and leadership in addressing climate change. So Healthcare Without Harm has partnered with the World Resources Institute to bring their Cool Food Pledge to the healthcare sector and provide technical support to participating hospitals. The Cool Food Pledge is an opportunity for institutional food service operations to reduce their food-related greenhouse gas emissions and tie their health-promoting, plant-centered meal efforts directly to climate change. It's a cross-sector international effort to achieve a science-based collective target of reducing emissions from food by 25% by 2030. Participating hospitals in the pledge receive technical assistance and support from Healthcare Without Harm and Practice Green Health, including support in baselining food-related emissions, planning strategic purchasing and menu changes, tracking progress, and promoting success.
Lucia, I'm afraid we are at time so that we can go to the panelists. Do we want to, maybe we can breeze through these last three slides that you have? Yes, thank you.
Very quickly, thanks, Jackie. So the role of culinary professionals in this work cannot be stated too strongly. Culinary professionals are critical in the movement towards healthy food that nourishes people, communities, and our planets. Last slide. In 2016, Healthcare Without Harm teamed up with Menu of Change, an initiative of the Culinary Institute of America and Harvard T.H. Chan School of Public Health, to host the first healthcare culinary contest. Today, we are joined by this year's winner, Nina Curtis from Adventist Health in Roseville, California. Congratulations, Nina. And a reminder that our 2020 contest opens in October, and we encourage you all to apply and share your culinary creativity. Thank you so much.
Perfect. Thank you, Lucia. Of course, we had to get to those final slides to announce or re-announce. It's already been announced, but to welcome. And with that, let's actually welcome our grand prize winner, Nina Curtis. Hello, Nina.
Good morning, everyone.
Nina, we would have had you, under normal circumstances, we would have had you in person at Menu to Change as part of kind of your prize for winning the contest. So we're glad anyway that you can still join us virtually. I'm also going to bring up our other panelist, Jan Villarante, who is Director of National Nutrition Services at Kaiser Permanente, Northern California, as well as Zach Ramos, General Manager of Food Service at Kellogg's Away From Home. Hello, Jan. Hello. Oh, I almost said hello, Zach. There we go. Hi, Zach.
Hi, Jackie. Hi, everyone.
Thank you so much for joining us. Our panelists are excited to answer your questions from you attendees out there. So feel free to submit those questions at any time through the chat box on the right side of your screen, or use the share audio and video button to join us on stage. I know I had some people who were eager to join us early on in the session, but I wanted to make sure that we got through Lucia's presentation first. So if you're still feeling brave, please go ahead and hit that share audio and video button so that you can ask your question directly to our panelists. In the meantime, I have some questions. Let's start with you, Nina. Congratulations, of course, on being named America's top hospital chef. Can you tell us more about your winning recipe and how the plant-forward ethos manifests itself in your operations?
Sure. I want to say I'm honored to be recognized by Healthcare Without Harm and Lucia and her team. It's been a lot of fun, and the finalists and all the chefs that passionately participated, because I think we put our hearts on the plate. And I entered a well-known dish known by Seventh-day Adventists, who is our heritage here at Adventist Health. It's the haystack, AKA taco salad. Yes. And our CEO was like, "You're going to enter the haystack." And I was like, "Yes, and we're going to win. We've got to have faith here on the plate." The ethos was, I took a heritage dish, and I was a little nervous because I thought, oh my gosh, people already eat this. It's a very comfort food. But my team and I are masters at deconstructing and elevating. And that's what we did. So the ethos of, we're 100% plant-based cafe here in our corporate offices. And we're working to have an impression on our other system. And of course, that has to be understood financially and budgetary and just where our 25 plus hospitals are. So it's a delicious dish that I entered it with black rice and black beans and our lentil walnut meat, and then all the other toppings that are just delicious.
And you mentioned, that you're already a plant-based operation. So
yes.
How does, could somebody choose anything on your menu and sort of be like, oh yes, that is delicious and indulgent, but also plant-based? How does this haystack kind of fit into your overall menu? Was it something that was kind of very special and set apart, or is this kind of representative of what you would find on your menu regularly?
It is special because it comes from Seventh-day Adventist heritage. And I had done some research because I know many of our associates are Seventh-day Adventists. And the best way to get people to feel comfortable with, I think, a plant-based menu, and Seventh-day Adventists already advocate for vegetarianism, is to bring something that they already know and delight them. So yeah, I was a little nervous because it could have gone another way. But in our first hour that we launched it, we sold 89 dishes. And what happened, the people that knew the haystack were like, oh my gosh. And then we did this, are you a Frito base person or are you a tortilla chip person? And that got people really riled up. And then those that didn't know what a haystack was like, well, I'm just going for the ride. What are you all excited about? So we had a lot of fun with it, and entering the contest allowed me to have a template to really make every point, not just the recipe, not just the nutritional data. I worked with our marketing team and our communications team. We did a poll. We, had the contest for the winners, and it was really special, and it's continued to be. But that is what you can expect when you come in the Vitalized Cafe.
That is awesome.
Our menu.
I do agree. I think the best way to drum up excitement over something is to spark some debate between people about, which is better, the Fritos or the tortillas, or so that you get people, maybe they weren't interested before, but now they're like, oh, I need to register my vote and my voice. So that is awesome. Thank you so much, Nina. Jan, over at Kaiser, you've been working on local and sustainable food operations for a long time. And Lucia was talking also about the work that Healthcare Without Harm does, helping hospitals sort of identify those local purchasing and sustainability goals. Can you talk a little bit about your 2025 goal at Kaiser?
Absolutely. Kaiser Permanente has been at the forefront of making the connection between environmental impact and human health. In 2015, we we surpassed our environmental stewardship goals. And so we developed new goals to achieve our total health vision by the year end of 2025. Kaiser Permanente's Vision 2025 is addressing 100% waste diversion, carbon positive footprint, safer chemicals in healthcare, and having a food supply chain that's 100% sustainable, aligning with the Healthcare Without Harm standards. The food not only needs to be sustainable, but has to be a quality product that tastes good at an affordable price point. We're currently at 43% sustainable food spend. Our initial strategy was to replace like-for-like food products and sustainable food products, and offset the cost of contracting opportunities in other areas, because initially, food was more expensive. Sustainable food was more expensive. We saw price normalization in about 3 years in many cases, and we're seeing like supply and demand pricing take over, which we're very excited about. We're also seeing more products becoming available in our industry because we're asking for the full spectrum of items, not specific, produce or, bakery or, meats. We're asking for everything to be sustainable. As a part of our strategy, we're trying to also leverage volume across business sectors such as, schools, prisons, restaurants, entertainment venues to drive an affordable price point. Our goal is not only to go 100% sustainable, but also infuse quality products into our communities that we serve at affordable price points as well. Our next, we also see the value of strategic spending in the community. Our volume of business, at Kaiser Permanente during COVID has made a difference with local food companies' survival during these unprecedented times. So we're going to be placing a lot of emphasis on local, foods as we move forward. Our next steps include reverse engineering our menus with the sustainable food products we already know exist, and placing an emphasis on the community impact spending with diverse suppliers. Our procurement dollars are valuable in the community, not only from an economic standpoint, but also to decrease the carbon footprint and to promote diverse suppliers.
That is great. Thank you so much, Jen. I feel like there's more to tease out in there, but you brought up the topic of your suppliers and working with different vendors and stuff. And of course, we have Zach here from Kellogg's Away from Home. Zach, you've had almost 2 decades of experience in the food industry, including working with the healthcare sector. Can you talk about some of the previous partnerships with healthcare food service that you've worked on and learnings around the unique challenges and opportunities of this segment that came out of that?
Sure, be happy to. As you mentioned, I've been lucky to spend a lot of my time in food service working specifically with healthcare. And in doing that, I think 2 main themes of opportunities or challenges have arisen when it comes to incorporating more plant-forward, healthier menu items into a facility, into a menu. Number 1, I think, is how to effectively incorporate a crave-worthy item into a menu. And I want to give kudos to Nina because what she's doing with the haystack is a great example of taking something beyond what healthcare food service might have been 5 to 10 years ago with Plant Forward, which was probably the salad bar or a build your own veggie burger. Making something that's crave worthy and unique definitely grabs attention and is more exciting to consumers. I think the second part, though, is how do you drive awareness? So once you put something on your menu, how do you get trial? How do you get someone, before I ever worked for Kellogg's, I was not the type of person that would eat Plant Forward until I realized how delicious it was in trying it. How do you get someone like me that's looking to eat a little healthier, be a flexitarian, to trial these foods? So, there's a couple things that we've had success with from a menu standpoint. We have a culinary team. We work with chef advisory boards, and we come up with programming that helps do what Nina has done on her own, which is create activations that are exciting to customers. We have something we've called Make the Flip, where instead of a typical veggie burger, you're building international flavors or fusion type of concepts into builds that are more exciting and not your standard fare. The second part of that, from an awareness standpoint, I think there's an opportunity to partner with manufacturers and healthcare leaders to drive the messaging you want to drive, whether it's coming up with promotions to do a meatless Monday to make it fun to engage in plant-forward foods. There's a lot that we've been able to do with customers to help amp up their messaging and really be a partner in their success, almost as a pseudo marketing agency, because I haven't been in a single facility where folks are swimming with a ton of time to create and market on their own. And we have some of the resources to do that. So we've been successful helping folks in that manner.
That's great, Zach. I just want to amplify that point. That's something I certainly hear. And we here at the CIA sort of bringing together these different pieces of the puzzle. So many people in the operations side and the food service side are kind of talking about how do you get the word out? How do you get buy-in, you know, and as you said, actually, a lot of these partners in the manufacturing and supplying side, you're built on marketing budgets and resources that can kind of really help. And from what I've heard from many of you, you know, it's not just about putting your specific brand out, but it's really about partnering with your with the operators to how do you build this that works for everybody and specifically works for their context. So thank you. We've actually got some brave people. Let's see if I can bring them up. Eli D'Souza said that he wanted to come up on stage with us. Sometimes this ends up not working out. So I'm not sure if Eli is going to join us. Let's see if Christina Bodanza wants to join us also. But if not, I've got more questions for the panelists. Okay, sometimes we lose them in the ether of the internet after I say that they can come up. But just a reminder again for the attendees, please feel free to submit your questions or join in the chat or join us on stage. We've already got nice comment. Oh, here's Christina. Hello, Christina.
Hey, Christina.
Thank you for joining us. Yes.
I wasn't sure that would work either. So I really have to first of all say thank you for this opportunity with Menus of Change. I'm a regional executive chef for Compass Group in the Midwest, and this is a hard sell with our senior dining, Morrison Living, because in the Midwest, they're all about the meat, right? Meat and potatoes. Where's the meat on my plate? And being able to go through this Menus of Change program these past few weeks, I have really been able to bring to my members, my culinary teams, the knowledge you've been sharing on how to label things better. So instead of it being bolognese, being Tuscan bolognese, and including those legumes and those health with a smaller portion of meat, more plant forward. So any advice anyone could give me on more ways to change the predominantly meat-focused Midwest clientele in senior living, I would really appreciate.
Great, thank you. Does somebody want to jump in with their advice?
I will. I think there's so many new products available and the texture, right? And the flavor. So if you can emulate, obviously this is something that's very important that I think we bring to people's attention as professionals, emulating those flavors and then that texture. I mean, you can do quite a bit with sprouted organic tofu or, you know, portobello mushroom that sliced on the bias can look like, you know, steak. And there are things out there that look more like chicken and beef, if you will, or start them with a stew and have those textures and get them excited about the flavors, that they still have the texture, the mouthfeel. Maybe they don't even think about mouthfeel, but we talk to that. I think that's exciting. I think that's when someone that comes into our cafe that is not even on our property, but within our system, when they bite into that vitalized burger and they go, oh, wow, okay, it's not mushy, it's not this. So I really pay attention to that.
And if I could build on that just for a second. So I think that it's really important to, as Nia said, focus on the flavors and the item and not necessarily the fact that it might be meatless or plant forward. You know, calling something a Chipotle black bean chili instead of a vegetarian chili is a way to kind of bridge the gap between creating something that folks are interested in. They know they like Chipotle, they know they like black bean. It just happens to be better for them and plan forward. But that's a good way to find different ways to get this type of food in front of people.
And I also think sampling is huge. Sampling is huge because when we've introduced things, I can see it in, you know, our associates' eyes. And I'm like, just sample it. If you don't like it, I'll take it right back. But usually they take that spoon. By the time they get it in their mouth, I'm a bit convincing. I kind of get right next to them. I come from around the counter. I'm like, come on, just try it. You know, if you don't like it, okay. But at least you know. At least you know. And then they're like, okay, she's right up in my face. I guess I have to before COVID, right? And it's so fun if we're just excited Yeah, my dad's a chef. He's not vegan. I'm 20 years vegan. So I just lean in with compassion and excitement.
I love that. Thank you so much. And thanks so much for being brave and joining us, Christina.
Thank you, Christina.
I'm afraid actually we are already out of time, which seems crazy that we are already at the end of the session. But don't worry, we've still got some parting words from all of our panelists. They're all going to be sharing for us their top takeaway from the session in 6 words or less. So before we go, I just want to, or before we get to those top takeaways, I just wanted to encourage you all to engage in our interactive activities coming up next during this break, sponsored by Oatly. If you've had the chance to stop by their booth in previous weeks, you'll know that they are a fun crew. And this week they've got a special culinary demo happening in the sessions tab, looking at innovative comfort classics. Don't forget that you can also use the networking tab to connect one-on-one with other MOC attendees. And of course, we've got lots going on in our sponsor booths in the expo section. So please do stop in there as well. All of these activities count toward our weekly raffle or our weekly presenter book giveaways, as well as our grand prize raffle for free registration and travel to our 2021 Menus Exchange Conference. All right, let's get to those 6-word takeaways. Zach, what is your 6-word takeaway?
Mine's going to be 7 words, and I had to fiddle with the grammar to get it to 7 words. But collaborate with partners to amplify desired message.
Oh, love that. So great. Thank you. Jan, your 6-word takeaway.
Making the healthy choice the easy choice.
Oh, love that also. Nina.
Dance like no one's watching when the whole world is now.
Oh, I love it. And I love that you took something not specifically related to food, but like is what inspires what we need to do to change the food system, right? That's amazing.
Yes.
And Lucia, you get the final takeaway.
Mine's a few words over 6, but it's close. Bringing new meaning to the old phrase hospital food.
Oh, I love it. Thank you again, everyone. Lucia,
Thank you.
Nina, Jan, Zach, for making the time. Thank you to all
Thanks,
of you
Jackie.
out there watching
Thank you.
and enjoy the rest of the series. Thanks, everyone.
Bye.
Thank you.